Greetings, my name is Jane Henrici. I am a socioeconomic anthropologist working as a consulting senior researcher and gender advisor. I am also professorial lecturer at George Washington University in Washington, D.C. I am conducting with colleagues and students 4 COVID-19 research projects using remote qualitative and quantitative methods, all with a gender and intersectionality lens. In this recording, we will talk about 3 of those projects, for which data collection ends at the end of August, and our reports will come out in September. We are conducting for the first project research with residents of Wuhan, China, to learn more about their quarantine experiences. In particular, we would like to learn about the role that the city's neighborhood associations might have held for ensuring that families were fed during that period of the pandemic. We launched our original data collection in early July 2020, and since February 2020 have been reviewing data and analyses collected by Chinese and other scholars. Reports focused explicitly on medical indicators have found that, in terms of mental health, women across China under 45 years of age with relatively high levels of education and work responsibilities have described feeling greater stress than do men. Meanwhile, reports focused on gender relations have found in China, as have researchers across nations, other health issues disproportionately experienced by women, including rising rates of gender-based violence and problems linked to the relatively higher numbers of female essential workers in medical and other facilities. No reports that we have seen have discussed any relatively greater pressures on Chinese mothers of young children compared with fathers in terms of added care work with closed schools and constrained sources for household food provisioning. Indeed, those pressures might not have been experienced or might have been slight compared with others felt at that time. We hope to learn more about this with our study.
Hi, I'm Colleen Heidorn. I'm a recent Princeton grad on Dr. Henrici's research team. Our second project explores ways in which farmers and growers of diverse gender, racial, and ethnic backgrounds are affected by and adapting to disaster across the state of Maryland, both the slower onset disaster of climate change and the sudden onset disaster of COVID-19. While many enterprises across the country have closed in recent months, and although farm work is often particularly vulnerable to sudden onset disasters, most farms, including those in the US run by women and people of color, have stayed operational throughout this pandemic. We are therefore speaking both to farmers and to farmer support organizations, and have recruited through a combination of utilizing online databases and snowball sampling. We have yet to fully analyze our data, but one thing is already clear. For farmers across the state, this crisis has confirmed the need for stronger local food systems. Once finished, we hope our analysis will inform future disaster and climate action carried out by farmers, as well as governmental, private sector, and nonprofit stakeholders. Despite certain roadblocks, summer is when Maryland farmers are busiest, after all, and, as we're likely all learning, remote research presents a unique set of logistical challenges. We are certain that this work is an important first step towards deeper research on the critical topic of diversity, farming, and food security.
My name is Shelby Amato. I'm also on the team with Colleen in another study with Dr. Henrici, researching migrants in the DC metropolitan area. We're investigating the risks and challenges faced by Latinx migrants, as well as the services provided by support organizations. Previous research on sudden and slow onset disasters, including extreme weather events and climate change, demonstrates that disasters have unequal impacts on health, migration, and financial stability. We're currently setting up online qualitative interviews with members of immigration support organizations. It has been difficult for these staff members to find the time to speak with us because they have so much work to do to aid migrants in the United States. Our recruitment and investigation has needed to overcome obstacles related to both online logistics and the stressful nature of this pandemic. It has also been a challenge to grasp the full picture of migrant needs during the pandemic. We know that these individuals are among the most vulnerable to its effects. Regional detention centers are experiencing high volumes of cases, and Central American Latinx immigrants are disproportionately among essential workers. Our hope is that this research will help stakeholders better support Latinx migrants going forward with climate adaptation and future disaster risk reduction.